I'll just open with the karakia. Whakatakata hau ki te uru, whakatakata hau ki te tonga, kia mā kina ki uta, kia mā taratara ki tai, he akai ana te atakura, he tio, he hoka, he hauhu, ti he Māori ora. Kia ora koutou everybody. Welcome to this webinar about the importance of fundraising to the work that the Mental Health Foundation does. So Shaun Robinson aho, I'm Shaun Robinson, I'm the Chief Executive of the Mental Health Foundation. So yeah, I'd just like to sort of start off talking about what it is that we do as an organisation and why our fundraising is so important. And for me, it's something that's actually very personal. So I live with bipolar disorder. I'm happy to sort of call it that. And you know, it's a long-term mental illness, mental health condition. I started experiencing the symptoms of my bipolar quite early in my late teens and into my 20s. And by the time I was in my 30s, my life was just really chaotic with the symptoms of very deep depression, terrible anxiety and panic attacks, interspersed with times of being really elated. And yeah, my life felt very out of control. And consequently, I was highly suicidal. I think when my GP finally asked me, have you ever thought about suicide? I said, how many 100 times a day counts? And it kind of is a constant source of awe to me, I guess, that I look back now at that time when life was just so incredibly difficult and painful, you know, deep psychological and emotional pain. And to know that now I live really well, that, I'm happy, I'm a parent, I'm a partner, I hold down a really interesting but big, pressured, complicated job. I make a contribution to the world, and still live with bipolar disorder that has not gone away. But also the most amazing thing is that I get to draw on that experience that I have and use it for the benefit of the community and use it for the benefit of others. And that's really incredible. Again, I sometimes have to pinch myself to think, is this really true? If you'd asked me at the time in my 30s or told me that not only would I recover and lead a really good life, but that I could actually use those experiences for good, I would have probably laughed bitterly in your face. And so it leads me to sort of really think about, what is it that allows me to lead this really good life now, in spite of living with bipolar disorder. And I think when I think about that, it's all the things that the Mental Health Foundation is on about and is trying to influence, and why we really need the support of the community to help give us the fuel in the tank to do it. So yes, I get really, I've drawn on effective services, and I've been lucky. I've got services when I needed them. There were problems with those services, but they actually found a medication solution for me, and therapies helped me. So those things have worked for me, and they worked because they worked for me as a white middle-class cisgendered baby boomer male. So the system was designed and the services were designed really with me as the sense of who the client was. And I remember sitting in the waiting room, and there were Pacifica people and Māori people, and who obviously had a much harder life than I had. And I thought, man, you know, I can figure out all the BS that's going on in this service because I understand how this is working. But, you know, for many people in the system, it was just kind of like, it was just overwhelming and not effective. So yes, I got really good services, and continuing to advocate for really good services that work for all people, and that are accessible when people need them. That's a key thing that we do. But the services I got and the medication I'm on, they addressed my symptoms, but they don't make me happy. They don't make me flourish. They don't give me well-being. And what does that is a combination of things. It's the behaviors, the lifestyle, the habit, the skills that I've learned often the hard way, you know, in terms of how to manage my own mental health and my well-being, and how to navigate when times are tough, because times still do get tough. It's the support that's built in around me in terms of my family, my friends, my workmates. You know, it's that network of support around me that helps me to stay well. And you'll see in the background there, we've got the 5 ways to well-being. You know, the notion that there were little things that I could do every day to build up my own mental health and well-being, and that I could have some influence on those chaotic forces that had almost overwhelmed me and almost killed me. You know, that was a huge revelation, and it still excites me when, you know, I talk about these things and I see people running off and getting a piece of paper and writing them down, because it's so empowering to know that there are things you can do. So promoting those things, those things that we can do to support each other and to manage our mental health and well-being in good times and in bad. You know, that's such an important part of what the Mental Health Foundation does. But then another reason why I live well with bipolar is because I'm a white, cisgendered, middle-class, tertiary educated baby boomer. You know, all the things in the economy and the society are designed to make me succeed, because it's set up by other white, middle-class, cisgendered males over centuries. You know, and so I don't have poverty, homelessness. I don't, you know, I've always been able to work and earn a good living. I don't face racism or homophobia or transphobia. You know, so for me, the system is designed for me to succeed, and is not driving the traumas that can exacerbate my poor mental health if I had it. So again, you know, being able to advocate around the kind of social conditions that impact on people's mental health and drive so much for mental health, and actually trying to create a society where those social and economic conditions uplift people rather than crush them down. You know, that is a core part of what we do. And if we don't do all 3 of those things together simultaneously, then we won't succeed in creating a society, you know, where people have positive mental health and can cope with the ups and downs of life and support one another. You know, we have to have a safe environment that, you know, has uplifting social conditions. We have to know and be encouraged and support each other in the behaviours that uplift our well-being, and we have to have good, effective support services early when we need them. So that's what we do. That's what we do at the Mental Health Foundation. We try to create that through a whole range of activities, and you know, in order to do that, and to do that to the level of quality that we do, we actually require, this year, we require $4 million in fundraising to sort of fill up the tank to allow us to do that. And, you know, that number just keeps going up each year, because there is a hunger for the stuff that we do. There's a hunger for the positive stuff. There's a hunger to get behind the things to change our society. There's a hunger to try and build a better service system. And so more and more people are engaging with us every year. Most of our work is increasing by 10 to 20% per annum. 1,020,000 people used our website in the last year. In the Mental Health Awareness Week campaign that we just ran, 54%, over half of all the adults in New Zealand were reached by that campaign. 68% of all Māori adults were reached by that campaign. And people adopted the kind of behaviours of reaching out and having a supportive kōrero with people, to really high levels. People really like what we do, and they're reaching out and getting involved, but that drives more and more work, and we need more and more people. We need more and more sophisticated ways of dealing with that. So yeah, we need $4 million a year, spread across a whole lot of different things. So one of the key focus for the organisation is to make sure that our work doesn't just work for people like me, but as treaty partners in New Zealand, and looking at the negative impact that colonisation and racism have had on the mental health and well-being of Māori. Māori are a key priority audience, and we've really put a lot of work into making sure that what we produce in terms of resources, in terms of campaigns, in terms of training, all the things that we do in the community work for Māori. And to do that, we have a really awesome Māori engagement team that just keeps growing and growing, because the more we learn, the more we know we need to learn. And we pay for all of that ourselves. So, this year that we need $300,000 to pay for that. We get out there into schools, and you'll hear more about that. We get out there into workplaces, and we do training. We provide resources. We innovate in programs to build well-being into those spaces. And we need, a couple of $100,000 to help support some of that work. We send out 180,000 suicide prevention resources in the last year from our Resource and Information Service. So, the public really wants this stuff. That stuff's going up and up and up each year. And we need, over $300,000 to support, that work. So the resources get put to great benefit. And across the board, we are seeing that what we do is really having a really awesome impact. So our Māori engagement approach is that rather than just taking something that's conceived from a Pākehā perspective and then going, let's translate that into te reo, as much as possible, we try to start with pure Māori concepts, with approaches to well-being that are based around Māori order, around that notion of holistic well-being that use things like te whare tapawhā. We start there, and then we translate that into more mainstream concepts. And that's why we're getting such huge uptake from Māori. That's why all of our campaigns are promoting behaviours that support well-being. We're actually getting higher engagement from Māori than from mainstream, and higher change, higher levels of adoption of those habits, of those skills and behaviours by Māori than non-Māori. So it's hugely important, and we could not do that highly innovative work and be that effective without the support of the community, to give us this year, $200,000. Next year, it'll be $300,000. It is just growing like that all the time. And ultimately, when you support us in this work, what you're doing is you are contributing to building the mental strength, the mental health strength, the mental uplifting the mental well-being of the whole population of New Zealand. That's my big, hairy, audacious goal, and I actually think we can do it. The Mental Health Foundation can reach every person in New Zealand and have a measurable impact on increasing their mental and emotional well-being. And, you know, we're going to do it, but we can't do it without your support. So thank you so much for all of you who have supported us so generously so far in many, many ways. There are thousands of people each year who participate in events, who give to us with money, who give with their time, with their energy, who are champions for our messages, and we could not do it without you. Thank you so much. I'm now going to pass over to one of my colleagues, Maisie, who's one of our policy and advocacy kaimahi, really driving that work to try and ensure that we have a just, fair society, and that systems, policies, services, you know, really work for the people. Kia ora.
Kia ora, Shaun. Tēnā koutou katoa, ko Maisie Thursfield tōku ingoa. I'm a senior policy analyst at the Mental Health Foundation in the Policy and Advocacy team. And I'm currently zooming into you from a very rainy day in Māori in the Tasman district. Part of the role of the MHF is to be a critical friend of the government. And it's really important that we maintain an independent voice to be able to call them out when they haven't quite hit the mark, but also to support them when they're doing things well. So that's why in the Policy and Advocacy team, our work is funded through fundraising and not through government contracts. So our team works to create a system and social change for all New Zealanders. This means that we advocate for the social and economic conditions that influence our mental well-being to be favourable. So that includes being safe from domestic abuse and neglect, having meaningful employment and a living wage, freedom from poverty, racism, discrimination and bullying, and access to safe, warm, dry housing. So our work program is really broad and it's super varied because there are just so many things that impact our mental health and well-being. This variation of work means that we always work closely with other teams at the MHF, like you'll hear from today, and we also work closely with other organisations in our work. So often in our submissions, we'll formally support other organisations' work, especially if, you know, they're the experts on that subject matter. There's some really awesome collaboration that happens across the NGO space, and we're super grateful for our friends and allies across the different sector. So the reason we're able to advocate for social and economic conditions that impact our mental well-being, we do that through influencing decision makers like ministers and public officials. We also influence the creation of laws by making submissions to Parliament, and we also make submissions to government when they're setting policies or strategies that we want to, you know, have a say in. Some successes from our team include a reversal of the police's, they were going to introduce quite a discriminatory recruitment policy, and we advocated to overturn that policy, which was going to bar all potential new recruits from taking antidepressants. Would-be recruits would have needed to be medication and symptom-free for 2 years before they could be considered for a job. And so we advocated strongly for this to be stopped, as it was unacceptable and discriminatory. We also successfully campaigned for to end armed police trials, as well as a lot of other organisations. We argued it would be disproportionately impactful for individuals experiencing mental health crises and suicidal distress, and also for our Māori and Pacifica communities. This year, a big focus for us has been on calling for the government to implement the full agenda of change from He Ara Oranga, the report from the 2018 Inquiry into Mental Health and Addiction. So He Ara Oranga called for a transformational approach to mental well-being to prevent problems developing, respond earlier and more effectively, and to promote mental health and well-being. So far, the government's response has been really centred around expanding service access and choice. And although early support and services are super important, service expansion alone won't actually transform our approach to mental health. We won't solve the crisis one person at a time. So we at the foundation and in our team are continuing to push for the prevention of mental distress and to empower communities and individuals to learn the behaviours and skills that will actually protect and enhance mental resilience and wellbeing. So this will continue to be a huge focus for us going into the future. One of the recommendations from He Aotearoa was to repeal and replace the Mental Health Act. So the Mental Health Act sets out the circumstances in which people may be subject to compulsory mental health assessment and treatment. It's intended to be used as a last resort for people in vulnerable and distressed states. However, the Act is 30 years old, it's out of date, and it's heavily criticised for being out of step with current models of wellbeing and care, and also Aotearoa's commitment to human rights. It's also applied inequitably. So with Māori being nearly 4 times more likely to receive compulsory mental health treatment or to be subject to a community or inpatient treatment order than non-Māori. So we are working hard to call for a whole new approach to caring and supporting people when they are unwell. Currently, we're working on our submission for this repeal and replace of the Mental Health Act, which is due at the end of January. And we expect this reform to continue to be a primary focus of the policy and advocacy team for the next few years as it progresses through the government processes. We also have a range of other topics that we get involved in throughout the year. And I'd encourage you, if you're keen to see what those all are, to check out our submissions page on the MHF website. So we keep that updated and we'll upload submissions and policy positions as we submit those or send letters to ministers. So definitely have a look at that if you are interested to see what else we've been getting involved in. We uploaded one earlier this week, last week, which we submitted on the Bipolar Healthy Futures Bill. So yeah, that's just a bit of an overview of the policy and advocacy team. Super varied, super interesting, and really couldn't be done without all the amazing fundraising that we're given. So kia ora, thanks for listening. And I'm now going to pass on to my colleague, Sophia. Kia ora, Sophia.
Kia ora. I actually think Donna's going next and I follow on from her.
Ka pai. Awesome. Kia ora koutou, ko Donna Tairi ngata tuku ingoa, he huri tēnei o te aroa me taunui. I hail from Rotorua, and my dad and I also have whakapapa links to Waikato, and I think that's important to acknowledge that given that our mahi highly supports our tangata whenua, with Māori being our priority, and also acknowledging our other priority groups, being Pacifica, being Asian, and also our rainbow communities. But I am the manager for community engagement health promotion. We have a couple of projects that we hold within our team, and a highly skilled team of health promoters. One of those projects is the work that we do in schools. So we've been really grateful for fundraising to allow us to go out into schools, engage with schools, carry out promotion work, connect and be part of conversations and dialogues, and just be a po within schools and say, hey, we're the Mental Health Foundation, we are here. In many schools that I've found on my travels has really appreciated that. And we're quite realistic in our approach. We say we can't change the world, but this is what we can offer. And we go there with a listening ear and also offerings. And some of those offerings is supporting our 2 wellbeing, all of our wellbeing, school wellbeing programs, being Sparklers and also Pause, Breathe, Smile. So Pause, Breathe, Smile is a mindfulness program for school-age children between 5 to 12 years of age, and Sparklers is a awesome bank of resources, wellbeing resources. So they also have resources for schools and also resources for parents and whānau. So we're able to promote and ensure that it has a wide reach reaching our rural and our urban communities. So with that, we bring to the table networks of our own to ensure that we're strengthening that promotion across Aotearoa. In addition, we're able to have cultural input into those programs. So the fundraising efforts helps us to, myself and Māori Engagement supports the cultural content that goes into both of those programs, as well as MHF is able to develop free and deliver free resources to our schools. And then there's also our awesome campaigns, being Pink Shirt Day, as well as mahi. So we support the school engagement and the health promotion work that goes into supporting Pink Shirt Day, both campaigns. So with our Pink Shirt Day, which I know my colleague Sophia is going to talk more to, obviously the funds go into campaign development. Going forward, I mean, how does it support the work that we do? Well, obviously it allows us to promote supportive and safe school environments and strong supportive cultures within schools and their communities. It helps us to expand our reach, as I mentioned. These programs are entry points, we call them entry points, with the hope that schools look at and focus on more of a whole school approach. And then there's our increase in reaching our priority groups, being Māori. We were really happy with Pink Shirt Day last year, and also mahi. We doubled our reach with kura kaupapa and wharekura here in Aotearoa, so we were excited about that. And also these programs have shown that they are having a positive impact. So both programs have conducted evaluation, and that they've shown that there has been positive impact on the social, mental and emotional learning, and helping children manage their emotions, feel good and build healthy relationships. Going forward, obviously we want to continue to grow connection and relationships with schools and kura. We want to continue to support Pink Shirt Day and mahi and its reach to workplaces and schools, and also look at more work around evaluating our schools' activities so that we've shown the effectiveness and the impact, and continuing to progress towards a whole school approach. So I'm going to hand over to Sophia now.
Kia ora, Donna, thank you. Kia ora koutou, my name is Sophia Graham. I'm the Communications and Marketing Manager at the Mental Health Foundation. So the Communications and Marketing team works across most of the programs and projects at the Mental Health Foundation, and the kind of marketing that we do is called, social marketing. So it's a slightly different type of marketing. It's not social media, but it's marketing for behavior change. So we are not trying to sell products, but we're trying to sell behavior change. And the program that I'm going to talk about today is one that is entirely funded through fundraising, and it's a program called Pink Shirt Day, a campaign called Pink Shirt Day, which is a campaign that works to eliminate bullying in schools and workplaces and communities across Aotearoa. It was a campaign that was founded in Canada more than 10 years ago, and was brought to New Zealand by an organisation called Rainbow Youth, and has been run by the Mental Health Foundation since 2011. So it was originally funded by the government, but the funding could never keep pace with the demand for the work that was needed to address bullying. So bullying is actually a really big issue in our schools and our workplaces and our communities. More than a third of students are bullied in our schools a few times a month. 1 in 10 New Zealand workers is bullied regularly in our workplace, and this is actually where we beat the OECD in some of these rates. And bullying has a huge impact on our mental health, and it's not just the people who are bullied whose mental health is impacted, but it impacts our workplaces and our schools and the environments that we live in, that we go to school and we work in as well. People who are bullied report higher rates of depression and anxiety. They have higher rates of stress. They have higher rates of fatigue. They experience low self-esteem. They're more likely to experience higher rates of drug and alcohol abuse. And that's also, unfortunately, they experience higher rates of suicidal ideation. So it makes sense that the Mental Health Foundation would be really strongly involved in Pink Shirt Day, and we're really passionate about this work. And it's thanks to the support of our fundraisers that we've been able to hugely upscale Pink Shirt Day over the last 10 years to the place where we are at now, where more than half of New Zealanders are aware of the campaign and changing their behaviour because of the campaign. So Pink Shirt Day is run at the end of May every year. We're incredibly lucky to have a fantastic corporate partner in Cotton On. And so for the last 3 campaign cycles, we've partnered with Cotton On to sell official Pink Shirt Day shirts in their stores and online. And last Pink Shirt Day in May, we raised over $500,000 for our campaign. And that was supported by individual fundraisers running morning teas in their schools and workplaces and doing all kinds of other fantastic initiatives for us. And because of that belief in Pink Shirt Day, we've been able to do some incredible activities and invest in some incredible programs, which means that we're not only raising awareness with Pink Shirt Day, we're able to really invest in the behaviour change that makes a meaningful difference to the people who are bullied and in the environments where that bullying is taking place, which is what we're here to do. And I think because I've been at the Mental Health Foundation for so long, the last Pink Shirt Day was my 9th Pink Shirt Day. I've been lucky enough to see the difference that sustained investment has created. In my role, I get to talk to people all the time who are impacted by bullying, and I've really noticed that difference that has made. Bullying makes people feel incredibly alone, and that's what that behaviour is intended to do. It's intended to isolate you. It's intended to make you feel different. It's intended to make you feel that you are that you don't belong. And there is something very special about Pink Shirt Day when we ask everyone to wear pink and we ask everyone to stand together and speak up and say that there is no place for this behaviour, that this is not something that we tolerate in our country. And particularly in those early days when, I think in the first year we sold 400 t-shirts compared to this year when we sold 40,000. To see that, to truly see that sea of pink, for people to realise that people do care, that people have noticed, and that people are trying to make a meaningful difference in that behaviour. I think that it can't be underestimated what a difference that has made for people. And in terms of what we're doing with that money, we are investing in making a positive difference in that behaviour. So it's not that we just want to stop bullying. The people who engage in bullying behaviour tend to have been bullied themselves. People who bully don't emerge out of nowhere. They tend to have some trauma and some harm happen to them in their own lives. And what we want to do is be able to encourage them to replace that behaviour with positive behaviour of their own. So we're investing in programs mostly run in schools at the moment that teach people to regulate their emotions and work well in schools and in the workplace. So we've got 2 really wonderful programs running in schools called Pause, Breathe, Smile, which is a mindfulness in schools program, and Sparklers, which is a positive behaviour in schools program. And thanks to the investment of our fundraisers, we've also been able to evaluate those programs, which might sound really boring, but actually we have to be able to prove that the work we're investing in works. And in high schools, we're running a program in partnership with an organisation called Inside Out, which helps train students and teachers to be more inclusive of rainbow students, which is also evaluating really strongly. So that has been an incredibly powerful and impactful thing that we would absolutely never be able to invest in without the support of our fundraisers. So all of those things are entirely funded through our fundraising, and we're able to get to the root causes of bullying and create the solidarity and kindness and empathy that addresses bullying at its cause, and stops it from being able to start, and enables communities and workplaces and schools to create the kinds of environments where people can flourish and enjoy good mental health in the first place. And the long-term impact of changing those behaviours, we hope, is that people can enjoy good mental health and feel that they are part of their communities and that they can be themselves and be who they are, and not feel that they have to change, and not feel that loneliness that we know that bullying can cause. That's all I have to say. I'm going to hand back over to Donna. The other thing that I did want to say is that there are other behaviours, there are other negative social problems that we would really like to address through campaigns like Pink Shirt Day that we can't at the moment because we just don't have the funding. And your support is key to helping us do that. one of the things that we noticed through Mental Health Awareness Week this year, which is funded through the government, is the theme of that Mental Health Awareness Week was Take Time to Kōrero, and we realised that people really valued the opportunity to have really important, deep and meaningful conversations about mental health, which they don't have at the moment. And we'd really like to be able to have more than 1 week to do that, but we're not funded to do that at the moment, and we would really value your support to be able to do that for longer. Donna.
Kia ora Sophia, kia ora koutou. Just in wrapping up this kaupapa here today, on behalf of the Mental Health Foundation, tēnei te mihi nui kia koutou katoa, me o koutou hapori kua tai mai nei. So a big acknowledgement to you all and your respected organisations that have joined us here for this kaupapa today. We also want to thank our fundraising team, May, for organising this, and for our CEO, also to our CEO, Shaun, who opened up this kaupapa. So with that, if you do have any questions or information that you want to find out more about Mental Health Foundation, please do not hesitate to contact May. And yeah, all of our contact details is on our website. So with that, I am going to close. So me inoi tahi tātou, let's pray. Unuhi ia te punga o te waka kia rewa I te kāhui nui o hine ki runga e hau, pai marire. Thank you very much all. Ka kite.